Bismillahirrahmanirrahim. How are you, students? How is Ramzan is going? Last time we have discussed about lymphedema, its definition and primary and secondary classification of its, and then we discuss presentation and some investigations. The most important one was the lymphantography and ultrasound in MRI. Today we'll discuss some management options of this lymphedema. Now, one thing should be clear to you that this lymphedema is very difficult to treat. All these treatment options are just supportive and they are not very mm, accepted treatment options. But anyway, this is how we treat this patient. It's a, as you know, that's a bones are involved, skin is involved, so it's a multi-professional, multidisciplinary task, and many people from the different professions like nursing staff, orthopedic surgeon, and dermatologists, even oncologists if the cause is some malignancy, and some psychological support is also needed for these patients. Now, earlier the diagnosis and earlier the start of treatment, better the result are. But as the time passes with irreversible changes development, then treatment become very difficult. Now, goals of our treatment, why we want to treat this patient. We cannot revert it to normal position, but we want to achieve that pain relief because it's a heavy limb and patient then feels pain, and then we want to reduce the swelling to reduce weight of the limb due to lymphedema and to prevent secondary complication if we do not treat. Now, before we start treatment, we have to do a general workup, initial evaluation, ask about history of onset and how it progressed, past history of any medication, any malignancy, family history, history of obesity, and other diseases of the leg like vascular and arterial and neurological problems should also be looked for. It's very important to know about the patient's social circumstances, that whether he can afford treatment options, what is his education, can, because you have to know that educational level of that patient, because you have to consult that patient as well. And previous any current treatment which she or he is receiving. And it's very important to explain all treatment options to the patient because compliance of therapy is very much important. If the patient does not show compliance means if he does not follow the treatment advices, then it's become futile effort to start treatment. So as we told you before that relief of pain is one of the main goal that we want to achieve because this patient, especially the patient with breast, with some malignancy, like when see a breast, there is lymphedema of the upper limb. Why? Because there is either due to radiotherapy or due to surgery, the axillary lymph nodes are damaged and then that leads to swelling, and that swelling is usually very painful. Now, this swelling may be due to just that, due to the damage to the lymphatics, but sometimes the nerve is also damaged, or the mets of that CFS has gone into the bone, so it may be bone pain, or it may be some joint pain. So it's very important to know the cause. Otherwise, your treatment will be not effective. So it should be targeted towards the basic cause. As you should look for these all causes before giving any treatment. And then we have a list of a toolbox of options starting from NSAIDs to corticosteroids, tricyclic antidepressants, muscle relaxant, antiepileptics, nerve blocks, in physiotherapy. So these all are options for a patient with. We go step by step and see where a patient respond to the medication. The main problem with the patient for which patient come again and again is swelling. Patient wants that swelling should be reduced. As I told you, that's very disappointing treatment of lymphedema because it does not revert back to the original position. But what you can do, you can offer whatever is available so far in this in so far research. So bed rest elevation and compression bandages, elastic bandages, compression garments, massage exercises, and these all you will try and hope for the reduction in swelling, which is not very much appreciable. I mean, the swelling will not be decreased in just a few days. It takes months, years. Current preferred option for reduction of swelling is decongestive lymphedema therapy. Now it has two phases. It's a two-phase process. In the first phase, intensive period of therapy, and then there is maintenance phase. Now intensive phase comprises of skin care and manual lymphatic drainage in multi-layer bandage and exercise. Now the skin care is there are many problems in skin. We'll discuss later on. But the manual lymphatic drainage means that you uh, apply some compression pressure over the leg with both hands, and you expect that with this pressure, slowly and gradually the lymph will flow upward toward the heart. Now, you cannot understand better by this picture or this just description, because you see, she will apply pressure here, gentle stroke like pressure, like massage type, and then come downward, downward. So when you press it here, so a negative pressure develop in the venous channel, in the lymphatic channel, if they are there. So the rest of the lymph will slowly and gradually move up, and similarly you will come down, down, and that is a lymphatic manual lymphatic drainage. Now, to better understand this manual lymphatic drainage, you should write this manual lymphatic drainage of lymphedema in YouTube. You can see the video of it, that how they are doing it. Now, skincare is basically job of dermatologist, but you should know the basic principle. You should keep the leg dry, because if it is wet, it macerates and it then leads to infection. So keep it dry, and after keeping it dry, then you apply some moisturizing ointments. So that it does not crackle. There is difference between keeping it wet and keeping it moisturized. Wet means that wet will give rise to infection, while applying moisturizing creams or ointments after it is dried, it skin will be remain healthy, and it will not breach. If there is marked hyperkeratosis, so keratolytic agents such as 5% salicylic acid should be added. Now, these what we should use, it's not our domain. It's as I told you earlier, that the management of lymphedema is a multidisciplinary task. So, for skin care, you will directly involve the dermatologist. You see, if sometimes we advise patient go and wash it with soap, but some soap contain some chemicals which may give rise to dermatitis, and they can aggravate a problem or can complicate a simple problem into infection and dermatitis. Then there is multi-layer lymphedema bandage and compression garments. Your aim is to reduce the swelling to some extent so that patient feel a bit better. Now these are graduated elastic stocking, which has much higher pressure at ankle, and slowly and gradually as you go up, so the pressure is reduced. But one thing should be kept in mind, that a patient in home having a history of vascular insufficiency, or there is ankle brachial pressure index is less than 8, so you should be careful while applying these pressures garments or dressing, because you will compromise uh, that patient. Already the lymphatics are compromised, but if you are applying a tight dressing and patient develop vascular insufficiency, so even this disease limb will be lost. Now there are two types of elastics, multi-layer this elastic dressing. One is non-elastic and other is elastic. So non-elastic is preferred because they are not much very tight as compared to just compression stockings. In mild cases, you can apply this compression stocking, and in well-developed case, you will do this multi-layer bandage and dressing. Now, this is a therapist who is applying a multi-layer, which means many layers are applied. And this is compression garments in a patient with CA breast, you can see. So it tries to keep it in its own place. What we want to expect from the multi-layer lymphedema bandaging, we want to reduce edema, we want to restore shape of the affected area, although we cannot restore it 100%. And we want to reduce skin changes, because when skin is exposed, so this there is dryness, hyperkeratosis, and papillomatosis. So to avoid those changes, these things, the dressing also help in skin care as well. Sometimes there is lymph drainage from the skin. So that is called lymphoria. So it's also eliminate lymphoria due to pressure, and it supports and it softens subcutaneous tissue. Now, exercise also has a role in reduction of the swelling, but vigorous exercise should be avoided. Why? Because in vigorous exercise there is anaerobic respiration, and there is lymph is also produced from the muscle as well. So it will increase the pain of that patient. So it's only mild exercise is advisable. Avoid prolonged static activities like carrying heavy bags or standing for a long time in one place. The better exercise are slow, rhythmic, isotonic movement like swimming and massage. It will increase venous and lymphatic return through the production of movement between skin and underlying tissues. Exercise, in addition to reduction of this generalized lymphedema, it also maintains joint mobility. Now, if some patient cannot move, so then in those immobile patients, you will do passive exercises, passive exercises like massage of that patient. If patient is bedridden or unable to move anywhere, so the very least thing is to elevate that limb so that there is some gravity under gravity effect. There should be some movement of limb as well. Now, role of drug is controversial, rather not well established. Like there are studies on flavonoids. Flavonoid is, is a antioxidant, and some research has been done on it. But after research, they found that flavonoid is placebo. It has a placebo type effect. Like if you do not use, even then there was no extra benefit. And diuretics some people use, but it should be used with care because it's of no value in pure lymphedema. Diuretics are helpful if there is associated cardiac or other problem in that patient. Otherwise, in pure lymphedema, it's useless. Now, so far we've discussed non-invasive technique like exercises, multi-layer dressings, and manual lymphatic drainage. Now, the last option is surgery. Now, not all patients can benefit from surgery. Very few patients who are fit and who are know that what will happen to that those patients, because I will show you pictures after that, few pictures, because it's not very acceptable surgery, but these are the only options so far available. Now, the bypass procedures is just theoretical thing. Bypass procedure means that suppose the distal lymphatics are fine, they are patent, but the lymph node area there is obstruction to the lymph flow. So you can anastomose lymphatic vessel with the venous vessel with the veins, and you expect that it will flow. Now, it does not so far any very promising long-term effects. Second is liposuction, and then there is reduction procedure. Now, bypass procedure, I told you it's a disappointing so far because there's not ideal situation all the time. If there is lymphatic obstruction, the lymph nodes are obstructed or lymph nodes are damaged, but even then, if you do anastomose, it's not always helpful. Liposuction means removal of the extra fat tissue if they are there. Now in a limb with swelling lymphedema, it's mostly due to lymphedema, but patient also have fatty tissue there. So when you do liposuction, you remove that extra fat which is there in the leg. So the weight of the leg is reduced, but lymphedema is there. I mean that this reduction of weight is not due to removal of this lymphedema, but it is reduction is due to removal of extra fat. So patient will feel some reduction in size of her or his leg. Then there are limb reduction procedures like there are many operations. Why? Whenever there are many operations, it means that none of them is very much encouraging with encouraging results. Now, when one operation is shrunk, in which wedge of skin or subcutaneous tissue is excised and wound is closed primarily. You can see this is cross section of a thigh level. So you remove a wedge of skin with subcutaneous tissue. So it means that you are removing some weight you are removing from that patient. So you do first on, suppose on the lateral side, and after 6 and 12 months, you can do on the medial side. So slowly and gradually, weight will be reduced. You remove this wedge and try to close this primarily. The other operation is known as Homan's operation. In Homan operation, you elevate the skin. You see, elevate the skin flap and then you remove the subcutaneous tissue up to the deep fascia and then you bring the skin flap back to close it. Now here you can see the skin flap has been raised, you elevate it, you remove whatever you can remove up to the deep fascia and then you bring the skin back, trim it, approximate it. Now mm, complication of it, one of the most common complications is skin necrosis because when you elevate the skin, so sometimes its blood supply is compromised and skin necrosis can occur. Now this is another operation, Thompson operation. Now here you see they elevate the skin flap and then they remove a deep subcutaneous tissue and these are lymph containing tissues up to the deep fascia and then you bring this back over the previous flap. So it's like double breasting type of surgery, like double breast coat. You see the dermis is sandwiched into the other dermis. So it here the theory is that these now we have put the skin inside, so some of the lymph will drain through this superficial lymphatic as well. So you are giving the the skin to act as a lymphatic drainage. So this is one of the operation known as Thompson operation. One more uh, try to reduce this limb swelling is Charles procedure. Now here you can see the circumferentially all the skin and subcutaneous tissue up to the deep fascia. You can see the muscle are there. So even deep fascia has been removed and after that the tissue which you have removed, you take skin from that and you apply over it. So it's a very disfiguring operation, not very good looking, but the our aim is to reduce the weight of leg. So it's reduce the weight of leg, but the our ultimate result will be like this. You can see here. Now this was all about lymphedema of the leg. It's not very important type topic, but you should know because when you see a patient with limb swelling, so you should have in mind the different causes and you should know its pathology and whatever we can do in these patients, palliative and some invasive surgery we have discussed. Now, thank you very much. This is all about lymphedema. If you have any questions, you can ask. Okay, Allah Hafiz.